Hi, my name is Brandy Snyder, and for my assignment, I will be reviewing an article titled Containing Pandemic Influenza with Antiviral Agents. This article is written by Ira Longini Jr., Elizabeth Holleran, Azhar Nizam, and Yang Yang. I chose this article because I was interested in the content. As a future nurse, having the knowledge of the information in this article can better prepare me in the event that a new pandemic strain of influenza develops. The purpose of this article is to explore the most effective strategies for the use of influenza antiviral agents for the first wave of a pandemic influenza or for a bioterrorist attack of a novel strain of influenza, and to compare the effectiveness of such a strategy with that of vaccination if a vaccination were available. The authors chose to perform this study because there is not enough time to manufacture vaccines during the first wave of an influenza pandemic, as evidenced by prior pandemics of influenza that we've had in the United States, such as the Spanish flu, the Asian flu, Hong Kong flu, and the swine flu. The hypothesis of this article is that antiviral prophylaxis is the most effective strategy for the first wave of a pandemic influenza. The authors worked on proving their hypothesis by using stochastic epidemic simulations to investigate the effectiveness of targeted antiviral prophylaxis to contain influenza. For each simulation, the contact structure of 2,000 persons is generated based on the age distribution and approximate household sizes from the 2000 U.S. Census. Each population included 4 neighborhoods, 1 high school, 1 middle school, and 2 elementary schools. Preschool children attended either small playgroups or larger daycare centers. Households included 1 to 7 people per family, with 33% of households being single adults. Person-to-person transmission probabilities were highest in households, lower in the daycare centers, playgroups, and schools, and even lower in the neighborhoods and population at large. Each day for each person susceptible, the probability of becoming infected was calculated on the basis of that person's antiviral or vaccination status, who was infectious in his contact groups, and their antiviral and vaccination status, and the group-specific transmission probabilities. Influenza was introduced by randomly assigning 12 initial infective people. The initial infected people were omitted in the analysis. Currently, manufacturing and distributing a vaccine to match a newly identified influenza strain would take anywhere from 6 to 8 months. Therefore, a vaccine would unlikely be available for the first wave of a pandemic influenza in the United States, and no vaccine would be available in the case of a bioterrorist attack. The authors have shown that targeted antiviral prophylaxis could have a significant effect on slowing influenza spread until a vaccine could be deployed for subsequent waves. The results showed that with the use of targeted antiviral prophylaxis, if 80% of the exposed people maintained prophylaxis for up to 8 weeks, the epidemic would be contained. And the model predicts a reduction to an illness attack rate of 2% and a death rate of 0.04 deaths per 1,000 people. Such antiviral prophylaxis is nearly as effective as vaccinating 80% of the population. This article is interesting in the way that reading a textbook is interesting. You have to do a lot of reading and rereading for comprehension, but it informs you that research is being done and the results are there that they have so far. It gives you information that you didn't know you needed. For example, I've never considered a pandemic influenza as being a bioterrorist attack. As a healthcare professional, what would be my first line of defense? Knowing that there is a prophylactic measure out there that can be taken is good information to have. However, where are the funds going to come from that would allow our healthcare facilities to stockpile such antiviral agents? How long could we keep them before they were no good anymore? There's got to be an expiration date. How much money would be wasted if we didn't use them before they expired? I think this research article is a good beginning, but its weaknesses show that there are many more questions that need to be answered before action could ever be taken. In order to have such an impact on the population, large numbers of antiviral prophylactic medications would need to be in stock, and the cost effectiveness of this is not included in this research article. Therefore, a cost effectiveness study is a subject that needs to be looked into further. And that's it. Here are my references, and if you have any questions, you can follow the link. Thanks.